Hi, welcome to my talk. Finasteride is a relatively safe drug. Side effects, when they happen in a minority of the cases. However, if you easily get carried away by what you read on internet, about what the grapevine tells you, and you feel that this side effect is going to happen in you, taking finasteride becomes a self-fulfilling prophecy. The mind is so strong that what you believe will happen. If you believe you'll get side effects, finasteride is not going to disappoint you. But well, in a majority of these cases, these are mere nocebo effects, like a patient who comes and tells me that I popped just one tablet and I have side effects. Can this even be true? Finasteride needs weeks or months to build up in the system. And side effects happen only once finasteride builds up in the tissues to a quantifiable amount. And this does not happen in a single day. So hang on and we'll discuss this further. If you haven't subscribed to my channel, please do. 80% of the people who watch my videos and many who benefit from them are non-subscribers. This is just like 80% of the people who know they'll benefit from finasteride but hesitate in taking the drug. As a hair transplant surgeon, I encounter on a daily basis incredible amount of resistance to taking finasteride. And this is a big pushback for those suffering from hair loss, androgenic alopecia, because the only medicine that works today, the only medicine that has been there for over 2 to 3 decades, the only medicine about whose pharmacodynamics, whose effects on your body, on your system, on your sexual health have been widely published. The fear factor and the apprehension, the emotions that finasteride, the mere mention of finasteride enkindles, is a huge hurdle, not only in my practice, but in many practices the worldwide. Negative expectations can play a powerful role in the choices that you make. However, let me clarify that I'm not downplaying the side effects of finasteride. Finasteride, in a minority of the patients, 0.5% to 1.5% does have side effects, but these patients, once they are weeded out, the side effects of finasteride are almost non-existent. If you have been worked up well, biochemically, psychologically, if you have done an in-depth consultation with your doctor, it is highly unlikely, highly improbable that you will ever encounter a side effect if you stay in touch with the doctor and taper the medicine from time to time, not let the medicine build up in your system. You are completely safe from the side effects of finasteride. Now, what are the plausible side effects of finasteride? The plausible side effects of finasteride are brain fog, decreased cognitive function, increased breast sensitivity, increased tenderness of the testicles, and sexual side effects which are more well known, like decrease in libido, that is decrease in sex drive, ejaculatory problems, infertility, and of course, inability to maintain an erection or erectile dysfunction. So these are the plausible side effects of finasteride. Anything else that you encounter, let me know. Most of it is a figment of your imagination. Your imagination, once you read about the side effects of finasteride, is very, very fertile, and most patients are a gullible lot at the age of 25. And that is the age at which hair loss strikes. And this is the age when you just do not want to take a chance. And this is what keeps you from the benefits, the many benefits of finasteride, the only drug today that has a significant effect on hair loss. Now, a little bit about the pharmacodynamics of finasteride. How does finasteride act? We all know finasteride is a DHT blocker. It inhibits the hormone 5-alpha reductase. 5-alpha reductase is the hormone which converts testosterone to its active metabolite DHT. Finasteride inhibits 70% of the conversion of testosterone to DHT. It does not completely block the conversion of testosterone to DHT. So that means that DHT is still available to the body for its many other functions. Strong inhibitors of 5-alpha reductase like dutasteride can have worse side effects than finasteride. Finasteride has a peak blood concentration of 6 to 8 hours only. That means that after 6 to 8 hours, its effectivity starts to decline. However, once you've been taking finasteride for up to 2 weeks to 4 weeks, the 5-alpha reductase inhibition that happens as a consequence of taking finasteride lasts a longer period of time, which is about 30 days or 45 days. So when you take finasteride, and if you have side effects, if you unfortunately find yourself in the 0.5% group which experiences side effects, your side effects will go off in 30 days. Side effects from finasteride are not permanent if you have been adequately worked out biochemically, psychologically, if you had an in-depth consultation with your doctor. Side effects happening with just one pill or medication taken till up to 2 to 4 weeks cannot happen because significant amount of this drug building up in the tissues takes this long. It is only your mind which is playing tricks with you, since the mind has been primed by your constantly referring to negative opinion about finasteride on the internet or listening to negative talk from your friends or family. However, there is a coterie of people, about 1%, who are very sensitive to this medicine. But even in those patients, side effects will not happen till 2 weeks are over. These are also the patients in whom the result kicks in much faster because of their sensitivity to finasteride. When you start taking the drug, many people report a bit of breast tenderness, testicular tenderness, and a bit of erectile dysfunction. This drug, once you start, the body responds to this drug by adjusting its hormonal milieu interior. And it takes about 4 weeks for the body to completely readjust itself to finasteride. And most of the side effects that you experience in the initial few weeks of having started finasteride, which are transient, will go away by 4 weeks to 6 weeks. In my practice, above 95% of patients are taking finasteride and they are taking the medicine without any side effects. Sometimes side effects do happen, but it is upon the doctor to continually advise the patient on either reduce the dosage, increase the frequency, or tell the patient to stop the medication for a period of time which may range from 2 weeks to 6 weeks. Stopping the medication for up to 4 weeks to 6 weeks does not cause your hair to shed again, because as I told you, 5-alpha reductase inhibition lasts for about 4 to 6 weeks. And this is the basis of my switch on and switch off technique, which has already been discussed before, and this is the link to my 5 strategies which help in preventing side effects of finasteride. It is fascinating how the power of negativity can overshadow any positive effects, affecting the minds more profoundly than positivity ever can. And not only for finasteride, you can see this happening in other walks of life as well. There is more negative information available about anything that you search than there is positive information. To conclude, I would like to say that having prescribed this drug for over 20 years, I can most confidently say that it is a safe drug prescribed by a doctor who routinely treats hair loss patients, safe if baseline testing has been done, if pre-existing health conditions have been ruled out psychologically as well as biochemically. For if it were harmful, firstly, I wouldn't prescribe it, and secondly, my patients would never take it. So let's put some perspective in your concerns and understand that when this drug is used appropriately under supervision, finasteride is the most useful drug today for keeping your hair loss at bay. So that is the talk for today. If you haven't subscribed yet, I would again request you to do so. Your encouragement keeps the channel going. God bless you.